patients are coming to see me with complaints of heavy, baggy, dark circles around the lower eyelids. This is something that affects a lot of people, and we're starting to notice it more and more even as we're younger. Now, there are both non-surgical and surgical ways to address this problem. Oftentimes we use them in conjunction because there's so many changes that happen in this area or can happen in this area to create the changes that we see. Those dark circles can be because of darkened skin in that area, thin skin that's showing the muscle underneath, and even hollowing or loss of fat that creates a shadowing effect. Up above that area, we tend to gain fat or have our normal eyelid fat move forward so it becomes more prominent. So we both have the development of what I call a hill and a valley down below. And that difference in level is what creates the bag. Now, when we're taking a surgical approach to this area, we have to make sure to address both issues. If we're not, we're going to be left with results that are unbalanced and unnatural. So in a lower lid blepharoplasty or a lower lid bag surgery, we're doing this surgery to address all the different changes that can be in that area. In my practice, we're usually readjusting the fullness of the fat in one area and moving it to hollowing or depression in another. This is called a fat repositioning lower lid blepharoplasty. The wonderful thing about this surgery is it can all be done through an internal incision in the eyelid where you don't really have any visible scarring. It protects the health of the eye and the function of the eyelid, all while creating beautiful, natural results that can last years. Now, not everyone needs fat repositioning. Sometimes the problem is just hollowing or just excess fat. That's where the customized approach to lower lid surgery is so important. This can't be a one-size-fits-all procedure. So I adjust my approach to my patient. If the issue is excess fat only, then we can remove fat and make sure that now we create a nice, smooth transition or contour going from that cheek up into the eyelid, so we get rid of that bag. If there's not extra fat and really just a loss of volume or shadowing or hollowing, we look to add volume in that area. Sometimes that can be done without surgery. That can be done with a lower eyelid filler injection. Sometimes we'll actually use your own fat, something called fat grafting, to replace the fat that's been lost. Both of these procedures can create great natural results that last years. The skin of the lower eyelid is also something we don't want to forget. Now, most people don't just have excess skin, although that happens, and sometimes we will just remove a little bit of skin through a small hidden incision right underneath the eyelashes. This result can be great at adjusting and smoothing that crepey, bunchy skin that can form on the lower eyelid. Oftentimes, removing skin is coupled with the other approaches that I take to adjusting the volume, the fat of the eyelid or the hollowing down below, and they can be done in conjunction. And the last thing to remember about the skin is it's not always about the amount. That lower eyelid skin has a tendency to start out very thin and very crepey, and it gets worse as we get older. So even if we remove a little bit of extra skin, we want to make sure that the skin that's left behind is as resilient and bright as possible. So oftentimes we'll include skin treatments with our surgery, and that can be laser resurfacing or a chemical peel, or even using deep radio frequency to build collagen in the deeper layers of skin. All of these things can go together to create a balanced, natural result. And that's part of what we'll discuss when you come in to talk about it, is exactly your needs. They're different than everyone else's, and it's my job to find that perfect approach for you.